Juste une question pour les interprètes. Souvent, je ne sélectionne pas l'écouteur avec le casque parce que je veux éviter le problème avec mon collègue qui ont... ça fait mal aux oreilles. Est-ce que c'est un problème quand je sélectionne l'haut-parleur de mon écran?
Greg, I'm sorry. I had actually just hit the gavel to bring us into order, but I did not have interpretation for your remarks there, and I'm not sure if that was if I should have or not. Do we have French to English? Maybe, Greg, perhaps you could give us a try here, and we'll make sure we do have French to English.
Yes, of course. And I apologize, Chair. I didn't hear that you had started the meeting.
I hadn't spoken the words. I just hit the gavel as you were starting to just as you were starting to speak. But and are you okay, Greg? Was there anything we needed? We're all good. Okay. So I do call the meeting to order. Welcome to meeting number 8 of the House of Commons Standing Committee on Access to Information, Privacy and Ethics, pursuant to Standing Order 1083H and the motion adopted by the committee on Thursday, January 13th, 2022. The committee commenced its study on the collection and use of mobility data by the Government of Canada. Today's meeting is taking place in a hybrid format pursuant to the House Order of November 25th, 2021. Members are attending in person in the room and remotely using the Zoom application. The proceedings will be made available via the House of Commons website. And so you are aware, the webcast will always show the person speaking rather than the entirety of the committee. Before we go to witnesses, a study budget was distributed to all of you. Are there any objections or questions? I see none, so shall the budget be adopted? Are there any opposed to adopting the budget? Seeing none opposed, the budget is adopted. And now we can proceed directly to hearing from our witnesses. And so for the first panel, we have Blue Dot, Dr. Cameron Kahn, Chief Executive Officer and Founder, and Mr. Alex Demarche, Director, Data Science. You have 5 minutes for your opening statement. Please go ahead.
Thank you, Mr. Chair, and good afternoon, everyone, and thank you for the invitation to participate in today's session. As you just heard, my name is Dr. Cameron Kahn. I'm Blue Dot's founder and CEO, and I'm joined by my colleague, Alex Demarche, who is Blue Dot's Director of Data Science. I'd like to begin my opening remarks with some background information to help provide some important context for today's conversation. First, I'm an infectious disease physician, and I've been in clinical practice for the past 20 years. Now, you may recall that 20 years ago, a novel coronavirus the world had never seen or heard of before emerged in Guangdong province in China and rapidly spread to more than 24 countries around the world, including Canada. And that virus was SARS-CoV. And I started my career in the midst of that outbreak, and it is an experience I have never forgotten. And it has been the inspiration for everything that I have done in the past 20 years of my career as a practicing physician, including the past 2 years of this pandemic, where I've been managing hospitalized and critically ill patients with COVID-19, as an epidemiologist and a professor studying outbreaks of emerging diseases and how they spread in our increasingly interconnected world, and as an entrepreneur who founded Blue Dot 8 years ago to harness the power of global data and modern digital technologies to strengthen our ability to respond to rapidly evolving outbreaks. Now, I'd like to be clear that Blue Dot is an organization that produces infectious disease insights, not one that collects location data from mobile devices. Our sole purpose and reason for existence is to protect lives and livelihoods from the growing global threat posed by emerging infectious diseases. Now, to fulfill our mission, we procure and analyze diverse worldwide data from publicly and commercially available sources to better detect signals of outbreaks around the world at their earliest stages, to forecast their patterns of spread to cities around the world, and to empower local responses that mitigate their health, economic, and social consequences. And with COVID-19, we did just that. Our technology used publicly available data to detect a worrisome outbreak emerging in Wuhan back in late December 2019. We then accurately forecasted the global pathways of that outbreak through the worldwide network of flights, publishing our findings online in the world's first peer-reviewed scientific study on COVID-19. And when COVID-19 began to spread here in our own country, we analyzed de-identified GPS location data that we procured from third-party providers, whom we selected because they adhered to Canadian and other internationally stringent privacy laws and regulations and had strong data privacy practices in place. These third-party providers collect GPS data from mobile apps that have a logical need for location. The apps require express consent to use location data and provide users with the opportunity to withdraw such consent at any time. Note that any location data we receive from these third parties has been de-identified before it ever reaches our organization. Some of these de-identified location data are also pre-aggregated before we receive them, while some data are delivered at the device level. We have never attempted to connect device level data to an individual. We have no purpose for doing so, and we are contractually prohibited from making any attempts to do so. Now, working with the Public Health Agency during this pandemic, we have analyzed and transformed de-identified GPS location data into actionable public health insights to help anticipate epidemic surges, to inform where and when the utilization of finite resources will have the greatest impact on saving lives, and to understand the effectiveness of social distancing interventions, all under rapidly evolving emergency conditions. Throughout our engagement, we have taken careful steps to ensure that any data or insights we have delivered to the Public Health Agency could not conceivably be associated with any individual. Now, I founded Blue Dot because 20 years ago, as a frontline healthcare worker, I watched a virus cripple an entire city for 4 months. I understood then that more disruptive outbreaks would follow, and they have, with greater frequency, scale, and impact. 2 years into this pandemic, I am certain that data, analytics, and technology can help us stay ahead of outbreaks that we will inevitably face again to protect lives and our way of life. And I am equally certain that we can continue to realize the value of such public health insights in a manner that fully respects and protects data privacy. Thank you again for the invitation to be here today.
Thank you for your impeccable timing on your 5-minute statement. We'll go next or begin our rounds of questions with Mr. Carrick.
Thank you very much, Doctor, and appreciate your testimony here today. Just to start off, I found it interesting in your opening statement. You talk about data that was procured from apps where express consent was given for location tracking. Do you, in regards to the data that was sent to the Public Health Agency of Canada, do you know how many mobile devices and/or individuals were used, had that data collected and then was sent to PHAC?
So the data, Mr. Chair, to the honourable member, the data that we collected in the context of the Canadian response to the COVID-19 pandemic was approximately 5 million devices in total.
Thank you very much, Doctor. And through you, Mr. Chair, this committee was provided a slide deck that appeared to be a presentation that would have been given to the Public Health Agency of Canada. Along with that slide deck was a letter from the Parliamentary Secretary to the Minister of Health. In that slide deck, the maps and whatnot, very, very interesting information, I'm sure helpful in developing policy. But in the explanatory slides at the end of that document, it states, and I quote, weekly values of active device users at the province and health region level can be downloaded directly from the Blue Dot Mobility Dashboard. Can you tell the committee what this data looks like both before it's uploaded to the dashboard and what information is accessible to the dashboard? And if I could first, I guess the first question is, did the Public Health Agency of Canada have or subscribe to access to that dashboard?
I'm wondering, Alex, if you wanted to take that response?
Sure. So for the first question, thank you, Mr. Chair, to the honourable member. We provide analytic reports of population level mobility metrics via reports like the one you reviewed. We additionally make the same kind of metrics available through a dashboard that the agency can use to view the same kind of analysis directly themselves. In no case is there individual device level data shared with the Public Health Agency of Canada. It's additional summary metrics of the type that are outlined in that report. It's the supporting data, but in a format that they can use to answer more dynamic questions rather than questions we've predetermined and included in our recurring reports.
Thank you, Mr. Demarche. And so just to be clear, the Public Health Agency of Canada did subscribe to or had access to this dashboard that's referred to.
Mr. Speaker, that's correct. The dashboard, just to be clear, only includes our summary metrics, not the original data. But yes, they do have access to that via the dashboard.
So certainly it's interesting, and part of the concern that's been highlighted by privacy experts is the ability to re-identify and to gain access or to the privacy concerns related to this information. Is there any possibility that we can see that data?
The contents of the dashboard we've shared with the agency, just to clarify, Mr. Speaker?
Yes. So would that data, the data available that's available on that dashboard, would that be something that would be available for this committee to see?
Certainly, yeah. We can follow up in writing with a sample that would inform you of the contents of the dashboard.
Okay, thank you very much, and that's much appreciated. With regards to the check-ins, the slide deck again specifies that anonymized device movement in half-hour windows at the bottom of the half hour. A device can have up to 48 check-ins per day, and devices with fewer than 8 check-ins per day are removed from the sample. Can you explain kind of the context? That's a tremendous amount of information. Can you provide detail as to how Blue Dot ensures that there is no way for that data to be re-identified?
Cam, sorry, Dr. Khan, I'm happy to take this one unless you'd like to jump
Sure.
in.
No, why don't you go ahead?
Sure. So to start, every question we're seeking to answer is about populations. These data are only useful in as far as they inform us indirectly about average contact rates in populations. We have no interest in individual devices. The information is only useful in aggregate. The data are de-identified, so in most cases, they're pre-aggregated, they're metrics, summary statistics about those populations. When we do receive individual device level data, there's no identifying information received. The contents of it are simply an approximate location and a timestamp. The description of half-hour reporting only pertains to that data that we hold in extremely secure internal secure data processing platforms with only limited number of internal users having access. We have a number of reasons for using industry best practices for data security. But beyond that, I mean, to your larger point about potential re-identification.
We are out of time for Mr. Carrick's round, and before we go to Ms. Hefner, I would ask Dr. Khan to, when speaking, perhaps hold your microphone a little bit closer to your mouth. It doesn't appear that you have a boom, but we'll see if we can get better audio for the interpreters. So with that, please go ahead, Ms. Hefner, for 6 minutes.
Thank you very much, Mr. Chair. I also want to thank the witnesses for being here today and helping us focus back on the question that we're addressing in this motion, which is specifically about the data that public health received in part through Blue Dot. And I'd like to just keep you talking, if you don't mind, Alex, about this. specific data, like what specifically did public health get? You said approximate locations and timestamps. So it's all general information. There's no way that public health could look at this data anyway, re-identify it, and know that Lisa Hefner was shopping at Lime Ridge Mall on the weekend.
Mr. Speaker, absolutely not. And to clarify even more, approximate location and timestamp is not even that level of data we do not share with the agency. It's further aggregated either by the geographic range and larger populations where the device was found, or over time periods of a minimum of 24 hours. So it's still more generic and non-identifiable than you've described.
And maybe Dr. Khan, you could comment a little bit from your expertise on how valuable this data has been in helping the government fight the pandemic, and maybe what it would have looked like if we hadn't had this data.
Mr. Chair, to the honorable member, thank you for that question. It's a really important one. And what I would say is that, with traditional public health data, we count things like cases and hospitalizations and deaths. But when you're dealing with a rapidly evolving outbreak, by the time you see a case, you're already too late. There's a whole bunch of things that have already transpired. There has been at some point earlier, there has been a contact, there has been an exposure. The person exposed might develop symptoms, get tested. By the time they get their test results back, you're already very far behind. The entire use for these types of data, again, I want to highlight de-identified, anonymized data, is ultimately to estimate contact rates in the population. That's what this is all about. It's just estimating how much contact is occurring in the population, because contacts are a leading indicator of what is coming next. Cases are telling you that something has already happened in the past. So it's a shift from being reactive to being proactive and anticipatory. And so this is, what we don't want to be is behind an outbreak. We want to try and get in front of it, and we want to try and change the course and trajectory. So pretty much everything we're talking about here really comes down to one thing: trying to inform public health about contact rates in the population, where they're increasing in a way that is a precursor to exposures, cases, hospitalizations, and deaths, so that an intervention can happen. So in my estimation, and I've been working in the field of emerging outbreaks for my entire career, we know that outbreaks spread quickly. It means we've got to be able to react and understand and move even more intelligently and in better coordinated manner. So, my sense is that, as a physician, I can take care of one patient at a time, but these types of analytics can support the public health response that could be impacting not only lives, but all of the economic and societal implications that we've had to endure for 2 years.
Is there any other way to get this data?
I don't believe so. There's been discussions about things like use of synthetic mobility data. I do want to highlight that much of those types of approaches are actually using empirical location data as a training data set. Secondarily, this, in a very stable environment, that might make sense. But keep in mind, the last 2 years have been anything but stable, constantly changing conditions, new variants, new, public health interventions and policies. This has been a very erratic 2 years, and empirical data are going to give us the best foresight into what is coming next, so that we can make intelligent decisions about how to mitigate, the health and economic and social consequences. And just the last thing I guess I would say is I do completely, Blue Dot and my work as a physician for the last 20 years is about protecting lives, but also protecting data privacy. And so this is something that we take very seriously and is really at the core of what we do as an organization, and candidly, why I founded Blue Dot in the first place.
If I still have any time left, Mr. Chair, I would ask
You've got just under a minute
to go into a little bit more detail about the extent that you go to protect privacy and security of this data.
Mm-hmm. Why don't I maybe start things off? I know we have time that's limited. Number one, any data we receive is de-identified before we receive it. internally, we have a whole bunch of procedures, both administrative and security procedures to manage and keep the data in a secure environment. Any outputs that we actually then analyze and produce and deliver to the public health agency, we aggregate them in a very thoughtful way so that there's no conceivable way we can envision that any of these data could be used to be reassociated with any individual. So from the very beginning of how we receive the data, how we store it, how we process it, how we aggregate it, how we deliver it, we're doing that in a very thoughtful manner in the entire process.
All right, thank
Very
you.
good.
And with that, it's now time for Monsieur Villemur pour 6 minutes.
Mr. Villemur, you have 6 minutes. Thank you, Chair. Dr. Khan, Dr. Demarche, thank you for being here today. I'm convinced that there are benefits that, as you've stated, I have no doubt about that. I also understand that you're not endangering the privacy of people, that you're applying the best practices. My concern is rather that when it comes to user consent, does the user fully understand that the data is being used for a third purpose? By a third party, that is.
Take that question. Thank you. Thank you for the question, and it's a really important question. Here's what I can say. I can't speculate as to what is in each person's mind when they are providing consent, express consent to enable location data. What I can say is that they do have the opportunity to withdraw that express consent at any point in time. But I think it is an important question around the consent process. That is something that, in our work with third parties, we have ensured that the organizations we're working with are adhering to all of the Canadian and other internationally stringent privacy laws and regulations, and that they have strong data privacy practices in place. And they've ensured us in writing around some of their practices. So we've done our due diligence as well in making sure that we're working with partners who are respecting privacy. I think with respect to the consent process, I think it's an important question and an important conversation about is the consent sufficiently informed? I would say I'm not an expert in that domain, but I am sure that this committee here will through all of the experts that have presented, will be able to arrive at a better assessment of that.
Merci beaucoup pour la réponse. Vous comprendrez que mon équipe.
You'll understand my concern, however. I want people who to understand that their data is being protected. As a committee, are we right to be worried about the whole procedures, all of them, the entire process?
Mr. Chair, to the honourable member, what I guess my response would be is that this process is one that requires some careful thought, and the diligence that is happening by this committee, I think, is certainly appropriate to be asking the question as to whether or not we are striking an appropriate balance. I think we've all heard that these types of data can be protecting lives, and it can be protecting a lot of lives and protecting society, and not just from COVID-19, but as I mentioned in my opening remarks, we know there are more of these that are coming. I think the diligence that is happening here with this committee, in my estimation, is appropriate to be looking at and just asking whether the processes can be better. If there's anything that we can do in response to a pandemic or anything else, is really just to learn from our experiences and look at ways that we can do things more optimally. So that's my input as a physician.
Thank you. I know you're saving lives. Now, did you choose TELUS, or was it the Public Health Agency of Canada that chose the supplier?
to clarify, TELUS is not a data supplier
Okay.
of us. We have no relationship with TELUS.
D'où proviennent les données que vous utilisez?
Where do you get the data that you use?
I'm sorry, could you repeat the question? I didn't hear it.
What is the source for the data that you use?
So we have two data suppliers that provide us with data. In our agreements with those suppliers, we do have contractual obligations that if we do make any public statements, we would just need to seek their permission first before making any announcements. So if there is a request for us to do so, we'd be happy to approach our suppliers to seek that permission.
Je comprends tout à fait le contexte.
I understand the context. I'd like to receive the names of the suppliers with, of course, all the necessary precautions. So you don't have any correct contractual relationship with TELUS. What type of businesses then are you working with? You don't need to name them.
First of all, yes, I'm sorry, not to create a yes and a no. We are not working with TELUS. And so that is not the source of the data. The data that we've been working with comes from providers that use GPS location data from mobile apps. Again, through that process I described of consenting to use location or being able to withdraw consent. And again, these are providers that are following all of the data privacy laws and regulations in Canada and in other international jurisdictions. So largely, these are providers that are actually interfacing with mobile apps.
Merci beaucoup.
Thank you very much.
Time for Mr. Green for 6 minutes.
Mr. Chair, in preparation for this committee study and anticipation of the witnesses, we spent some time looking up the bios, and we came across Mr. Demarche and noticed that he had been employed by PHAC until March 2021. So my question is, can Mr. Demarche share a little bit about his role with PHAC and elaborate on how this informs his work now with Blue Dot?
Yeah, certainly. Mr. Speaker, I was an epidemiologist, data scientist, manager of data engineering teams at the agency for years. In the context of the pandemic, I worked in the Emergency Operations Center, building and refining data systems used for more traditional public health data. I was aware of Blue Dot and had worked with Blue Dot's software in a previous role, but at that time had no interaction or involvement with Blue Dot's work. I was working in a completely different part of the agency. I mean, I will say, if the question is why I joined Blue Dot, I was persuaded by the mission, excitement about the technology, the possibility of really making a difference in public health. That informs my work and our interaction with the Public Health Agency of Canada, but I had no direct involvement in contracting or the agency's decision to work with Blue Dot.
But Mr. Chair, in the final points, I think you raised this important question, which is why I wanted to put it on the table, given the committee that we're in, just to assure the committee at any point when you were working with PHAC, would your information or contribution as an employee of the federal government contributed to the procurement process of this contract?
No, in no way whatsoever.
Okay, thank you for that. Mr. Chair, Dr. Khan listed entrepreneur on top of his medical expertise in his introductory remarks. Does the doctor have any comment on the commodification of personal data as it relates to Blue Dot's business model?
Mr. Chair, thank you for that question. Blue Dot's business model really is about using and driving innovation to protect lives. I just want to highlight Blue Dot's entire reason for existence is around developing innovation to prepare for and respond to not only the threat that we've just been enduring for the past 2 years, but many before and more that will come. As a physician in 20 years in practice, as I highlighted in my opening statements, I've had the experience on the front lines of crises, which has really informed how I see where the world is headed. as an academic and as a scientist, I've been studying outbreaks my whole professional life. Creating Blue Dot was less about creating a business and more about creating a vehicle.
So if we could, Mr. Chair, if we could get clear about exactly what is the business model, like how is it that you have been able to take your subject matter, Mr. Through the Chair, take the subject matter expertise as a frontline physician and recognizing hopefully the support and the need for the privacy of health information, even in instances of pandemics. In which way did he find this as an opportunity where there could be a commodification in a profit model or motive for this particular point in time?
So, Mr. Chair, just to respond to that, Blue Dot does have a for-profit business model. We use any revenues that we are generating for the purpose of reinvesting back in job creation, in innovating and developing better solutions and technologies, as I mentioned, for detecting, assessing, and responding to outbreaks. I do also want to highlight Blue Dot is a certified B corporation, a type of social benefit corporation that is oriented around social good. And I've chosen that business model because it is an opportunity to really scale the impact that we can have.
Thank you.
Sure.
Thank you. I do have two questions that are a little bit more specific. We've heard the conversation about there being the approximate location and the timestamp. How approximate is the location of the data?
Mr. Speaker, GPS data is not precisely, it's not located at a precise point in space. It's
Mr. Chair, through you to the member, in the reports that have been received, the weekly reports on mobility trends prepared by Blue Dot, the report shows, among other things, the percentage of increases and decreases in time spent in a home and outdoor gatherings, the number of movements and other measurements. So how would you arrive at these percentages if it's just an approximation of where they're at? Like, you would have to have residential level.
No, Mr. Speaker, it's an excellent question. That's actually a good example. So this specific analysis of home is not a reference to a home in the sense of a person's home. It's the primary location of the device, defined as a zone about 600 square meters. The purpose of that analysis is to distinguish devices that are staying close to their primary location versus those that are moving about as a proxy for contact rates in the population.
It's pretty safe to say, Mr. Chair, that people bring their cellular devices with them wherever they go. And 600 meters seems to be, although approximate, a fairly small circumference. I know that I'm out of time, but I do look to revisit this line of questioning in my next round. Thank you.
Mr. Green, and you'll have the opportunity to do that. But first, we are going to go to back to Mr. Couric, possibly sharing his time, I understand. So go ahead, Mr. Couric.
Thank you very much.
For 5 minutes.
So one of the concerns that I have is I represent a rural constituency where population density is significantly less than major urban centers. Are there specific protocols in place to ensure that the privacy of those who may live in rural Canada have their privacy protected?
Alex, do you want to take that one?
Yeah, I'm happy to speak to that one. Our general practice is to aggregate either by time or by a geographic boundary defined by population for all analyses we supply to the agency. So in that case of a rural setting, the smallest geographic boundary would be defined by the underlying population as calculated by Statistics Canada. That would be a relatively large spatial area. But we would still, in that situation, only report statistical summaries, number of devices, proportions, percentages, nothing conceivably identifiable or associated with a person, with an individual device or anything like that. So it's, I would reassure even a rural constituent that there's no prospect of identification even in that setting.
Okay, thank you. Now, I'd like to change. I appreciate the information and look forward to receiving the more detailed information that's available on the dashboard. But specifically in terms of your relationship with PHAC, we learned quite recently from the privacy commissioner that they were not consulted in terms of the use of in regards to the acquisition of mobility data. Did that come up in the conversations that took place over the course of Blue Dot's relationship with the government?
Mr. Chair, thank you for the question. Over the course of the relationship with the Public Health Agency, certainly the issue of privacy did come up on many occasions, and we had that conversation directly with the Public Health Agency about procedures and how we were working with the data and so forth. Certainly my knowledge or our knowledge of how the Public Health Agency may have spoken to the Privacy Commissioner is something that I wouldn't have full knowledge of. So to that specific piece, I can't speak to that, but certainly between Blue Dot and the Public Health Agency, this was a topic of discussion over the course of the relationship.
Thank you. And in terms of the siloing of data, certainly, it's logical that the Public Health Agency of Canada would need data to develop policies related to pandemic response. But was the data that Blue Dot provided, was it subject to a siloing where you were ever assured that that data would only be used within the Public Health Agency of Canada, or is it available for the Public Health Agency of Canada to possibly share with other departments?
Mr. Chair, I'd have to go back to our specific agreements and contracts. Our work with the Public Health Agency of Canada was largely for the agency to be able to support local and national and provincial, support these types of decisions across the country. And so, to my knowledge, that there may have been, and I'm not entirely aware of what the agency may have done and how they may have shared this with other jurisdictions across the country, but we provided data to the Public Health Agency for the purposes of better coordination across the country in terms of the response to the pandemic.
Okay, thank you for that. Just curious if you have a relationship with other levels of government, whether municipal or provincial, in your work here in Canada?
Yes, Mr. Chair. Yes, we in fact do. Any of the work that we have done with regards to the COVID-19 response in Canada, we have supported only, and in particular around these types of data, have only been with public health institutions in Canada at the provincial and at the municipal level.
Okay, one final quick question. There was an RFP for continued collection and use of mobility data that spoke to post-pandemic uses. I'm curious as to, and the government delayed that RFP to increase competition. I'm just curious as to why Blue Dot didn't submit a proposal with that RFP that's now been delayed by the government.
Terribly sorry, but I'm going to have to ask the witness to deliver maybe a 5-second response, or else return to it in a future round. So go ahead.
Just simply, we are not a mobile device location data business. We are simply an infectious disease insights business, and I believe that RFP was more oriented towards cell tower based data.
Sorry, Mr. Chair, just to be clear, that RFP was exclusively about cell tower data, which we don't possess. So we're not eligible for that RFP.
Now it's Mr. Baines will be next for 5 minutes. Go ahead, Mr. Baines.
Thank you, Mr. Chair, and thank you to our guests, Dr. Khan and Mr. Marsh, for joining us today. My questions are coming to you from Richmond, British Columbia. I wanted to talk a little bit about the opt-in clause. The more comprehensive the data is, the more useful it is. So what effect does the opt-in clause have on the usefulness of a data set? Either witness, please.
I'm happy to speak to this. In this context, because the data are only de-identified location information, there's no degree of consent for additional information. We never receive anything beyond the de-identified location or aggregated summary metrics related to movement. So for this purpose, there's no notion of degree of consent or additional information that we could obtain per device or in aggregate.
So, like the question I had, a similar question to a previous witness, and my question was like, if they had indicated that it would have been better to have an opt-in versus the opt-out, I'm just wondering if it would be useful. Then the data does not appear to be useful if we do have the opt-in. So the usefulness of the data, like, would that make it not so accurate in terms of the kind of data we're collecting? If it was an opt-in, you'd have less, maybe people just wouldn't be doing it.
Oh, I see. Mr. Chair, I do think it's probably true in the general sense that opt-in policies usually result in fewer people opting in than opt-out policies. If that's the question, I think that is true as a general statement.
Okay, and then just moving into your website states that Blue Dot was one of the first organizations in the world to detect the risk of COVID-19 and alert its clients. So how did Blue Dot identify the emerging risk of COVID-19 before anyone else did?
Mr. Chair, I'm happy to take that question. This I think comes back to the fact that Blue Dot is an infectious disease insights organization, not the work we're doing with mobile data is just one small piece of what we do. So what we have developed is a platform that is monitoring online, publicly available sources, and currently in 65 different languages, using things like machine learning to help pick up early signals or clues that there may be an outbreak occurring in a particular area of the world before maybe it's actually officially reported. That is something that we have developed over years because ultimately we know time is everything when you're trying to respond to an outbreak. So our platform detected that back in late December of 2019. And, as I mentioned in my opening remarks, knowing that there's an outbreak is one thing, but actually understanding its potential for global spread is another. And that's something that we also do using data on the worldwide movements of flights through this global airline transportation network that we all live in. And we, in fact, published the world's first peer-reviewed study accurately predicting where COVID-19 would start to spread. And that was back in early January of 2020. So I think this hopefully gives you a sense that as an organization, we are looking at this problem holistically, from early detection to assessment to emergency response.
Okay, thank you for that. And then just further to that, what efforts did you make to comply with Canada's privacy legislation?
So, Mr. Chair, I think I'll try and take that. Certainly, any of the data that we are working with is de-identified. It is not associated with any information about names, addresses, occupations, nationality, any data of that sort. In relation to the work we have done with population mobility data, we have ensured that we're working with providers that are following Canadian and other international privacy laws and regulations, and have had a chance to get assurances and do our own diligence on the data privacy practices that they had in place.
Okay, thank you, Dr. Khan. That's all I have. You're out of time, Mr. Baines. We'll move now to Monsieur Villemur for...
Mr. Villemur, you have 2.5 minutes. Thank you, Chair. Before beginning, I'd like to remind witnesses that they must have equipment provided by the House, otherwise the interpreters have trouble hearing them. I hope that won't count in my time. Dr. Khan, your testimony is fascinating. I'd like to draw upon your 20 years of experience so we discuss something on a broader level. What do you think of the use of data generally, through surveillance capitalism to modify a population's behavior. Capitalism surveillance is a danger. I know what you're doing is good, but if we go beyond what you're doing, what do you think?
Thank you for the question, and also apologies for my perhaps a suboptimal mic. I hope that you can all hear me okay. Look, this is it's certainly a broader question and an important question. I will say that our purpose, this is what I can speak to. Our purpose, we really believe, is a noble purpose. We are using business as a vehicle for social good and social impact. It is.
Je vais vous arrêter, Dr. Khan, parce que je suis persuadé.
I'll stop there. You've already convinced me of that. But based on your experience and your knowledge, do you think that data use can lead to capitalism surveillance that can affect and modify people's behavior?
I do think that there are concerning uses of data in some forms that can influence behavior and certainly can have negative social impact. So I think I would agree with that statement. I would say I don't believe the work, my own personal feeling is I don't believe that the work that we're doing falls into that particular domain. But I would agree broadly as a general statement that the statement that you've made is fair.
Merci beaucoup, Dr. Khan.
Thank you very much, Dr. Khan. I have no other questions.
You and then we'll go to Mr. Green.
I'd like to take a moment and actually pick up where my colleague from the block left off, which is to get a better understanding from both the Dr. Khan, and Mr. Demarche, based on their respective experiences. We're going into this new frontier of digital epidemiology or this surveillance to hopefully help change habits in a way that is beneficial to the public. But I'm wondering if, in your experiences, what is too far? What are the boundaries through which ethically we should not breach that would respect the privacy of people's health and well-being versus the balance of societal good?
Mr. Chair, perhaps I'll try and take that question. It's a big one. It's an important question. I think certainly the identification of individuals and having personal information obviously requires a different level of consent. Just drawing from my own experience with informed consent, when I'm talking to a patient about having a surgical intervention or something, I have to make sure I'm explaining all of the risks and benefits. So I think as it relates to personal information, there's an additional level of rigor that is certainly required. I do want to highlight, maybe perhaps to some of the earlier comment, our goal is we are not directly looking to change individual behaviors. We are generating public health insights to inform and empower the public health community.
If I could interject, Mr. Chair, if I could have Mr. Demarche also be able to add, given his experience at PHAC.
Thank you. I would agree with the general statement. There's widely accepted additional requirements when data could be associated with an individual in any conceivable way. And certainly in medicine and epidemiology, when private health information is included, there's additional levels of scrutiny and security. To clarify that Blue Dot does not hold any personal information across any of our holdings, mobility data or beyond. We don't have any private health information in our system in any sense, but that would require substantially more investment in privacy and security and different trade-offs between goods like public security in the context of a pandemic and other valid goods like personal privacy.
We go now to the final two questioners will be MP Patzer and MP Khalid for 5 minutes each. Go ahead, Mr. Patzer.
Thank you very much, Mr. Chair. I'm just going to start by asking you guys, how many countries are you collecting data from?
Okay, Mr. Chair, thank you for the question. the question about data, do you mean data in general, or?
Yeah, I guess it's generally speaking, because you talked about it's not just a Canada-based package, right? I mean, you're getting data sets from across the world. How many countries approximately?
I would say data, that is mobility data. I'd have to actually look up that number, but it's probably most of the world. In some form. Obviously, there are certain areas where there may be more devices and more data. We are looking at global airline and transportation data across the entire planet as we are looking through and trying to detect early signals of outbreaks. We're doing this in multiple languages across the world. So this is really a global problem and requires a global view of this kind of risk.
Okay, and then because that's obviously an enormous amount of data, it requires a lot of server capacity. Where are all the servers that you guys that host all that data? Is it all here in Canada, or where are those servers all located?
Alex, did you want to take this one, or I do, Mr. Chair? I will say neither of us are the technical leaders. We do have our head of technology. What I can say is everything that we have is managed in secure, highly secure cloud environments. We have full levels of encryption. We work with independent third parties to enhance our data security practices. We have administrative and operational procedures with how all our data are managed. Alex, I don't know if there's anything else you wanted to add.
Thank you. We would have to check the geographic provenance of the physical servers that our cloud providers use. In our case, I would. It would be Canada or the U.S. And we'd confer with our head of technology to be sure, and be happy to report back with a definitive answer.
Okay, I mean, the reason why I'm just wondering is because, again, with the context of the study is de-identified data. We've seen other reports of how they close to between 90 and 95% of individuals who had their data de-identified can be re-identified. So the reason why I'm just asking that, quite often it's your data is only as secure as the person who's trying to find it. So I'm just when there's multiple avenues, that's kind of what I'm trying to get at here. How big of a risk? I mean, I guess this would just be a broad industry-based question. And we see breaches of security within the government from time to time. We see it in the private sector from time to time, and quite often, actually. So how, industry-wide, how do we prevent, or what risks are there to this data being taken by a nefarious character?
I mean, Mr. Chair, we've spoken to our general cybersecurity and data security practices. So the honourable member will be aware, innovative Canadian startups need to be quite conscious of data privacy, as our innovations are globally sought after for a number of reasons. So it's top of mind. We use industry best practices, select secure cloud environments, internal auditing, access control processes, multi-factor authentication, the normal suite of cybersecurity practices required by our type of business.
Okay. I just got one more question here for you guys. For the federal response plan in April 2021, under the heading of surveillance, it states that COVID-19 surveillance is a pan-Canadian initiative. Numerous data systems, including existing surveillance systems with novel, non-traditional data sources. Sounds like a lot of things going on. It's a very vague, very broad definition for surveillance. Is there any issues with a definition like that might be too all-encompassing, too broad, without it being narrowly focused for the, maybe for the framework of what you guys are doing, which is providing specifically for infectious disease?
Mr. Chair, if it's helpful to clarify, in public health, surveillance is used as a catch-all term for infectious disease case data or other disease case data. I'm not certain which document he's referring to, but that is a general term for well understood within public health collection of data about individual cases in the context of an issue of public health importance.
I'm afraid that's time. And so for the final round, Ms. Khalid for 5 minutes.
Thank you very much, Mr. Chair, and thank you to the witnesses. Perhaps I'll start with Dr. Khan. Dr. Khan, how helpful do you think this collection of mobility data was in shaping a good response to the pandemic in Canada?
Mr. Chair, thank you for the question. I think it was actually quite helpful. Clearly, as I was describing earlier, the counterfactual, or how this would have played out in the absence of these types of data, would have been trying to catch up after we see that there are cases surging in a particular area. And this is a leading indicator by being a proxy of context of what is forthcoming. I will say that in our anecdotal assessments of the past 2 years, we've seen many instances where the analytics that we have generated and provided to the Public Health Agency have been precursors of subsequent surges, or provided really important actionable insights. What I think is, and I say this as a scientist, is that I think to answer that question appropriately and wholesomely, this would really require a full retrospective after the pandemic is over to understand, well, what worked and what didn't. Just as in any other instance, there's an opportunity to learn from this. But I think the simple answer is, I think a lot of lives were positively impacted and benefited from this type of work. This is notwithstanding the importance of privacy that we're discussing here today. But I do firmly believe it's had a very strong impact on protecting lives and livelihoods across the country.
Thank you. And Dr. Khan, what would be the impact if PHAC stopped using this type of data, deaggregated, anonymized data, to inform health policy in Canada?
Mr. Chair, thank you for the question. I will start, and Alex, feel free if you'd like to add your thoughts on this. I think it's a really, the metaphor I might use is that it provides some timely insights in a rapidly evolving outbreak, and the metaphor of not having that information and those types of insights. It's a bit like fighting an outbreak, but with a bit of a blindfold on. You don't have, for example, if there's a public health intervention on social distancing, you may not actually even know if it's working. And if it's having the intended effect, and where and when and how to adapt. So I think in many ways, if I'm just looking at it purely from a public health perspective, I think the lack of these insights would really compromise the public health community's ability to respond to this type of threat. I don't know, Alex, if there's anything you'd like to add.
No, I think that's right. It would be removing a tool that's useful in a context where we as a public health community don't have particularly many tools. But beyond that, I'm not sure. I think Dr. Khan gave a comprehensive answer.
Thank you. Thanks very much for that. And are you satisfied with your company's policies and protocols around privacy of protection? Are you satisfied with the government's protocols, including in the RFP and the contract, the role and the importance that privacy played within that?
Mr. Chair, thank you for the question. Let me just start out with our own privacy practices. Look, we are always interested in striving to continuously improve and enhance in areas where we can. I will say I am quite comfortable and proud of all of the work that we have done to ensure privacy at Blue Dot, starting with only working with data that's previously entirely been de-identified, with providers that are following the privacy laws and regulations, and being very thoughtful in how we generated outputs and share them with the Public Health Agency. I do want to note, we had been preparing for this years before the pandemic emerged. And that gave us the opportunity not only to develop the technical capabilities, but to have rigorous discussions and develop policies and procedures and standard operating procedures on how we would work with these types of data in a crisis. So I think we have been very thoughtful throughout the entire process. I probably am not well suited to speak on behalf of the Public Health Agency in the RFP.
Right, and with that, I'm going to bring this panel to a close. We're just a minute over time right now, and but I do want to thank our witnesses. With that, I will suspend, and we'll hopefully turn this around as quickly as we can for panel 2. Meeting suspended. So I now like to welcome everybody to the second panel. I call the meeting back to order. So I want to welcome our witness, and I understand we have just one witness from TELUS. So again, from TELUS Communications, we have Pamela Snively, Vice President, Chief Data and Trust Officer. You have 5 minutes for your opening statement. Go ahead.
Thank you very much. Thank you for the opportunity to provide this committee and Canadians with the facts about our Data for Good program. TELUS launched Data for Good in April of 2020 because we believed, as we still do, that our company's responsible use of data can play an impactful role in making more evidence-based and informed decisions. We created Data for Good to provide de-identified, essentially anonymous data to assist governments and health authorities in their efforts to stem the spread of COVID-19 and better understand the impact of interventions like restrictions and stay-at-home orders. Data for Good was a natural extension of TELUS' broader commitment to using our technology to enable social good in support of Canadians and the communities in which we live and work. As you heard from Dr. Tam, the Data for Good program provided critical insights that supported more informed policies. In short, it worked. And I want to make one thing perfectly clear. TELUS did not share any personal information with the government, not one iota. TELUS always puts its customers and their privacy first. At no time have we ever relaxed any of our rigorous policies about our treatment of personal information, including when we launched Data for Good during the pandemic. The Data for Good program operates on a data analytics platform called TELUS Insights, which is the only Privacy by Design certified platform of its kind in Canada. This platform uses de-identified datasets to reveal movement trends and patterns while protecting individual privacy. Under the Data for Good program, we allow data scientists from our partners, including the government, to have supervised and guided access to our secure Insights platform that contains only de-identified datasets from our mobility network. Those datasets never left our systems. The data of our customers, even de-identified data, was not sent to the government. I want to pause on Privacy by Design. That TELUS Insights is Privacy by Design certified is important. Privacy by Design is the international gold standard for privacy protection and was developed here in Canada by Dr. Anne Kavukian. Privacy by Design goes beyond the requirements of the law to entrench privacy protections into the design and operation of the IT systems, networks, and business practices of an organization. With this certification, our Data for Good program is independently validated as being rigorous in its privacy protections. And you also heard Dr. Kavukian's endorsement of our approach last week. We have taken a leading role nationally on the development and promotion of de-identification as a critical process to enhance privacy protections. TELUS is a founding member of Canon, the Canadian Anonymization Network, whose mission is to promote effective de-identification practices and includes the leading Canadian de-identification experts. Our commitment to de-identification is at the core of TELUS Insights. Thanks to our privacy-first approach, TELUS was able to leverage our Insights platform to provide pandemic assistance through Data for Good while fully protecting the privacy of customers. While some may compromise on privacy during a public health emergency, we did not. We are very proud of Data for Good, and we were intentional and explicit in our public communication about the program. We developed and published on our website 5 core data use commitments on how we would share de-identified data and protect privacy. These accompanied a full description of our program along with an FAQ. We had a banner on the main TELUS website that linked to this information. Before and after launching the program, we did op-eds, interviews with the Globe and Mail and other Canadian media outlets, and published news releases announcing new collaborations. We later publicized that Data for Good was awarded the International Association of Privacy Professionals Privacy Innovation Award in November 2020. Apart from our public-facing communications about Data for Good and Insights, we consulted with the Office of the Privacy Commissioner of Canada on our transparency plan. We provided them with an overview of our program, including the 5 core commitments. The OPC provided valuable feedback, which we gratefully incorporated. The final point I'd like to make is that as part of our effort to go beyond simple compliance with the law, we offer our customers the ability to opt out of our data analytics program. We see this as a reflection of our customer-first commitment. In closing, I want to reiterate that TELUS provided access to this de-identified data for the public good. The data contained no personal information, so the privacy of our customers was respected, and we made great efforts to be transparent about the program. All of this is consistent with TELUS' long-standing track record of protecting our customers' privacy. Thank you again for the opportunity to speak with you today. I'd be pleased to answer your questions.
All right, and with that, we'll begin with Mr. Kirk for 6 minutes.
Thank you very much to our witness for joining us here today. I found it very interesting, and I'm hoping you can unpack a little bit about what you meant when you said that data was never sent to government. This committee, and I'll give you a little bit of context for the type of response I'm hoping to get. We were provided a letter from the Parliamentary Secretary to the Minister of Health with a slide deck from Blue Dot as an example of some of the information that had been provided to PHAC from that organization. And we have not been provided a similar data set or information as to what the data looked like that TELUS had provided to the government. So I'm wondering if you can elaborate on what that means that it was never sent to government.
Absolutely. Thank you for the question. What I meant by that is that we don't actually send data to the government. The way our program works is that we allow data scientists from our partners to come onto our platform, our de-identified data platform, for supervised and guided access. There, they are able to do the queries that are consistent with the use and purpose that we've discussed with them, and that needs to fit with our program. And then they are able to create derived data, or what we call insights. And when I talk about an insight, the best thing to do would be to picture a heat map or a graph, a bar chart, or a line graph that would show movement patterns or trends. When the government would then, after they'd done that, they'd pulled out these insights, they would be able to download them before they could take them. We would review them to make sure they were consistent, that they met all of our re-identification risk metrics, and that they were consistent with the purpose for the contract. And then the government would be able to take that derived data or insights with them.
So was it officials from the Public Health Agency of Canada that went to to TELUS Data for Good, a specific location or virtual location? I'm curious as to exactly what that means.
It is a virtual location, so they're not physically on premise. So it was data scientists coming onto our platform. So we provide access to our platform, guided, supervised access, but it is virtual.
As I'm sure all of us around this table have mobile devices. There is a tremendous amount of information that is available, exists within the cellular providers that operate within our country, and there has to be a high level of trust there. And so I'm just curious as to if you would be willing to share some of what that data looked like when it was in fact sent to the Public Health Agency of Canada.
I can certainly take that away. We can share sample reports of what the data would look like, yes.
And then in terms of those who are able to access the platform, we've heard from some experts that certainly de-identifying and the ability for data to be re-identified is very, very much on a scale. There is anonymized and de-identified data can be names and cell numbers taken out of a data set, or it can be synthesized in a way that would make it virtually impossible for that to be re-identified. Can you highlight exactly what when officials from the Public Health Agency of Canada, data scientists, whatever the case was, were they able to what were they able to see when accessing your platform? Not just the reports, but what were they able to see?
What it might be more relevant for me to say actually what they weren't able to see, and that would be any information about any identifiable individual. The way that the platform works is more query based, so it's not as though they go on and see a bunch of data. What they're able to do is develop queries and get back information and insights drawn from that de-identified data. So that might be a clearer way of describing what they would see when they would come onto the platform.
So in a hypothetical, the government could then ask, say there was a sporting event, or could look at grocery stores or movement during a certain time of the day. Those are three hypotheticals, but that's the sort of queries that the government would be able to make of the system and the data set.
Perhaps you could clarify your question. If you're looking for movement during a particular sporting event, yes, but not in real time. One of the controls that we have on the platform is not to provide any real-time data, because that increases the risk of re-identifiability to something that is. So it would no longer be considered de-identified.
Yeah, I might run out of time here. I'm out of time, so I'll maybe follow up again later. But thank you for answering the question.
All right, thank you. And now for 6 minutes, Ms. Sachs.
Thank you, Mr. Chair, and thank you to our witness today. I look forward to hearing your answers to some of my questions. I listened to your opening statement, and I've also heard from Dr. Nkavukian, who was recently here, about how well developed, she raved about how well developed the TELUS Insights offering is. And being built by Privacy by Design at the forefront of this platform, your work sounds critical in offering insights that go beyond in protecting any identifying data. And from what I understand, PHAC never had access to any personal information. How did you make sure that they did not have access to this personal information is my first question. And then I'd like to ask, how does Privacy by Design protect privacy? And since you do have the certification, how rigorous was that process?
Thank you very much for those questions. In terms of the how do we ensure that PHAC or others on the platform do not have access to personal information, we went through a very rigorous process that actually took years to build the Insights platform to be what we wanted it to be. We realized years ago that there could be tremendous value in this de-identified network mobility data. So we're talking about the pings that devices make off the cell towers as they move about the network. If we can de-identify those pings and just look at the movement patterns, there were a number of social good uses that we could immediately see and just tremendous value. And we've seen that borne out during this pandemic. So we met with consulted with leading de-identification experts, spent a tremendous amount of time building the technical platform with the technical rules to de-identify the data. So, the stripping identifiers, but going far beyond that to, rules around the way that queries are made, controls on the frequency with which queries are made, and geography, aggregation. So a number of different technical controls and statistical controls. And then on top of that, we put in administrative controls. So I talked earlier about the guided and supervised access. That's another administrative control that we have in place where we're actually supervising what is happening on the platform and review of what is taken from the platform, as well as strict contractual controls prohibiting re-identification. So those are some of the ways that we control and make sure that we have reduced the re-identification risk to something that is very, very small. In terms of the Privacy by Design certification, I'm glad you asked about that. We're really proud of that certification. It is a very rigorous process. Our most recent Privacy by Design certification that we got for the platform, it was just before COVID, so excellent timing for the launch of Data for Good. It took over 4 months to conduct, and it's conducted by an external audit group, fully independent. They assess us against, there are 7 Privacy by Design principles. Those turn into 30 privacy and security criteria, and then again into 94 different controls that are illustrative of us meeting those criteria and principles. So it took, as I say, about 4 months. They complete that report, and then they have to take it to an independent accreditation board to have it independently reviewed before we can be certified.
So in other words, an extremely rigorous process a priori before PHAC could even access any of the data on the platform in a supervised fashion. So thank you.
That's correct.
Mr. Chair, how much time do I have? Okay, wonderful. So the intent of TELUS Data for Good and the program was to help PHAC understand and fight this pandemic. From where I'm sitting, it sounds to me that tremendous care has been taken by TELUS Data for Good to make sure the data is de-identified, which certainly is reassuring for me and is reassuring to Canadians now that you've just described the very rigorous process for certification. And from what I understand, the data that was then collected from TELUS Data for Good and supervised and reviewed before released was then posted each week on PHAC's website. So there was a level of transparency with Canadians of this data, which I think seems very beneficial as well as we communicate with the public why this information is so important in managing the pandemic and data as a tool. So can you speak to how the Data for Good program supported the COVID-19 response from your perspective of being engaged with this search process with PHAC?
Yes, thank you. I'm not privy to all of the uses to which the data was put. We have record of them, but I don't know them all personally. We heard Dr. Tam speak earlier about how valuable it had been to have mobility data and be able to layer that in with epidemiological data, similar to what Dr. Khan was speaking about earlier as well, and to be able to map what had gone on with the contagion and where it might go and make predictions. So to be proactive, as Dr. Khan said, as well as reactive. It was also possible to look at the impact of different restrictions and policies to see how effective they were. If as we all know, at the outset of the pandemic, there were a number of different restrictions that were placed on us that we hadn't experienced before, and whether or not they were effective in curbing movement, we were able to see by looking at these large-scale movement and trends and patterns.
Yes or no question?
We're way over time. And now for Monsieur Villemure.
Mr. Villemure, you have 6 minutes. Thank you, Chair. Hello to our witness. I have 2 questions for you that you can try to answer in the 6 minutes. How did you receive users' consent for the collection of the data?
The data that this is based off of at the point of collection is actually collected in the course of providing mobility services. So that consent applied to its use for mobility services and to provide the mobility services. However, when we de-identified the data, it was no longer personal information about our customers. So rather than relying on consent there, what we relied upon was ensuring that we had actually de-identified it. That was our focus, was to ensure that we had protected our customers' privacy and that we were transparent and clear about our use of that.
Donc, vous n'avez pas obtenu le consentement.
So did you not obtain user consent then?
We did not contain user consent for this specific purpose. What we relied upon, because this is not personal information, this is de-identified information. So the information was de-identified and then was shared for these purposes.
But before being de-identified, it was personal information.
Yes, it was. Before it goes through the transformations, it's personal information.
Okay. Je suppose que c'est normal que
I suppose it's normal that a TELUS user would think that TELUS would use the data to improve its service. However, the user might not expect it to be used for something else.
I think it's challenging to know what anyone expects, but I want to be clear that there's a very critical distinction between personal information and de-identified information. Personal information, we're very focused on consent and the privacy implications, but when it comes to de-identification, de-identified data, the de-identification process itself is what protects privacy. So that's our focus there, and that's how we protect our customers' privacy on that front. When it remains in personal format, our focus might be more on consent there. That's generally the primary driver in our current legislation.
Est-ce que l'utilisateur
Does the user consent to having his personal information de-identified?
We have a lot of information on in our privacy policy and on our website about de-identification. So in terms of all of the various uses and the concept of implied consent under our legislation, yes. Although under our legislation, it's not generally considered that consent is required. We're very transparent about that. We actually have, I would say, more information than most organizations might have. We have a lot of information about how de-identification works, why we use it, how it protects privacy, and then more information about how we actually use data that has been de-identified for analytics purposes.
Votre site web
Your website has a lot of information indeed. Now, the users have to know that they should go to the website to find this out, though.
That's correct. As I said earlier, though, we did do a lot of op-eds. We did media releases. We were very publicly transparent. I recognize that some individuals want to know everything that's going on with their data. Some don't want to know anything, and some want to know just in time when they're thinking about it, which is why we take it very seriously to put all of this information on our website. So for those for whom it matters and who want to know everything, it's there. For those who might just think about it from time to time, it's there when they're ready to take a look at it.
D'accord, merci.
Thank you. I'll paint a portrait for the next question. General data use. Surveillance capitalism is when you use data to modify behavior. And the source of surveillance capitalism is data. What do you think of the use of data for this purpose?
I'm not positive through to the chair through you, Mr. Chair. I'm not sure if I understand the question. What do I think about using data for surveillance capitalism? Is that the question?
Yes.
I'm aware that data can be used for good, and I'm aware that it can be used for ways that are not good as well. I think it's absolutely critically important that we're paying attention to how data is used, and that we do make inquiries, and that we are responsible in our use of data and transparent about it, which is exactly the model that we have followed at TELUS.
D'accord.
All right. I don't have any further questions. Thank you.
We move 1 minute ahead of schedule. I will move now to Mr. Green.
Thank you very much. And I'm just going to put to our witness that I'm going to ask questions maybe in what might feel like a rapid fire way. I'm going to try to ask you to be as concise as you can with your answers so that for the good and welfare of this study, I can move on to the next question. If I happen to interrupt, please don't take it as me being abrupt. I just only have a limited amount of time. So I'll begin through you, Mr. Chair, with asking if the witness believes or is the sale of the collected data a core part of TELUS's business model?
Okay.
So what we're talking about here today is the Data for Good program, which
If I could, Mr. Chair, I'm going to just direct the question. I'm going to ask very specific questions, and I'm going to require very specific answers. Is the sale of collected data a core part of TELUS's business model?
I think I need to be clear about what is the exact question. So if we're talking about the Data for Good program, there is no sale involved at all. It's almost exclusively done for free, or at most on a cost recovery basis. If you're talking about other types of data, just broadly, is that a core part of our business model? I would have to say no.
So if no, should it not then be required for a separate form of consent? i.e., if a consumer signs up with TELUS under the understanding that the core part of the business model is not collecting data and its distribution, should that not, under an ethical framework, require a separate form of consent?
If we were selling customer personal information, it would require a separate consent and a very express consent. We are not selling customer personal information. We're not sharing customer personal information. We're sharing insights drawn from de-identified data, data points drawn off of our cellular network, the number of pings, so that we can map population movements on a large scale to help with the pandemic. This isn't the sale of customer personal information.
Well, yeah, I mean, Mr. Chair, respectfully, when it's qualified as customer personal information and the idea of what's desegregated and not desegregated, and again, the constant emphasis of what consent looks like under current legislation, I would put to this committee that the legislation is currently the problem. So I guess my next question is TELUS only collecting the mobility data of its clients, or does it collect information of other telecom clients who end up pinging its infrastructure?
For our Data for Good program and insights model, we are only using the data of our customers.
What about for other programs within the TELUS Corporation?
I'm not aware of another program that is using data in this way.
Okay. So it is my understanding that when TELUS purchased Babylon Health in the UK, Babylon operated under an opt-in consent premise. But after the purchase of the app it was moved to an opt-out consent process. In fact, the Alberta Privacy Commissioner found that Babylon has not met the requirements of Section 7 of the Personal Information and Privacy Act with respecting to obtaining consent of collection, use, and disclosure of personal information unless otherwise authorized. Why does TELUS default to opt-out option for data collection?
I'm not sure where that information has come from, but TELUS has not moved. When we acquired Babylon in January of 2021, we made changes that brought the program under our privacy program, but we did not move anything from opt-in to opt-out. That was not a change that TELUS made.
Should there be a different standard of consent for meaningful consent when it comes to data collection that you share with governments or sell to third parties?
If we're talking about personal information, absolutely. If we're talking about de-identified information, then I think there's still a knowledge and transparency to encourage customer trust and to earn it. But there's no requirement for consent. And in fact, it's probably a little bit unrealistic in most of these contexts. And that's what we heard from Dr. Teresa Scaza. That's what we heard from the Privacy Commissioner, that in the context of de-identified data, consent is really not realistic and is not terribly helpful.
Are you currently, through you, Mr. Chair, is the witness here today representing TELUS, can they state on whether or not they're currently collecting mobility data from Koodo and public mobile subscribers for the Data for Good program as well?
Yes, we are.
And how aware are the clients of these other brands that their data is being collected as well and used in this way?
The privacy programs merge so that all of the communications have been similar.
So the Privacy Commissioner stated that the consent cannot be meaningfully attained from information buried in privacy policies or terms of use. So in the witness's opinion, how clear is it for the average person to find an op-ed for an opt-out for data collection?
Again, hard for me to know what is in anyone's mind, but where we are talking about an opt-out, and particularly where we're talking about de-identified information, the primary goal that we have is to protect our customers' privacy regardless of what selection or option they have chosen. That's why we have focused on the de-identification, the strong de-identification for our platform, all of the controls that we have in place to ensure privacy is protected. All of these consent questions, they all relate to customer privacy, and where we've protected privacy in a different way, that's what we have done. We've looked for other alternatives to protect privacy.
Thank you.
That concludes Mr. Green's round. And now for 5 minutes, Mr. Patzer.
Thank you very much. You made an interesting comment there in regards to the fact that consent is, I remember the exact word you used, but in regards to getting de-identified data, that consent was either not required or was kind of an inconvenience, more or less, to getting that data. So I'm just going to, if you want to comment a little bit more on that, why is getting consent such a problem when using de-identified data?
So I didn't say it was an inconvenience, but it can be, it may not be helpful if we're talking about the concept of de-identification is to remove the ability to trace it back to an individual. So it's no longer personal information. When we are talking about personal information, consent is very relevant, and we need consent for the purposes for which we're going to use it. But once we've turned it into de-identified information, that's part of the process of de-identification, is to protect that privacy, so we don't need to go back and get consent. We did hear from Dr. Khaled El-Imam about alternatives for regulating de-identified information, which can be very interesting. What TELUS has done is, in the absence of that regulation, we have gone and got Privacy by Design certification to give that assurance to our customers. We do have the use case reviews. We look at the data sets. We've built in a tremendous number of controls to ensure that our customers are comfortable with what we are doing.
Yeah, I kind of get hung up on the fact, though, that data was personal to start with, and you said over and over again that, you know, it's okay because we de-identified it and consent doesn't matter at that point. But the fact is you still had to get that personal data in the first place. We've heard, you know, about the social good of programs like this, but what about the ethical good of society and of your subscribers, right? You know, when you're clearly taking personal data without consent, without clear consent, even though it's being de-identified, but you said it yourself, you need consent for personal data, but you didn't pursue it. Why?
I want to be perfectly clear. We got consent to collect the personal information to provide our network mobility services. There is no personal information that we have done anything with without our customers' consent. All of what we've done has been in compliance with the law. It's once we de-identify the information, so there are no longer privacy impacts on our customer. We've protected their privacy by de-identifying the information, and that allows us to be able to use it for these socially beneficial purposes without impacting the privacy of our customers. So absolutely, we put the privacy of our customers first. We would not be doing this if it were actually impacting our customers' privacy.
Did you guys ever consider sending a text message to all your subscribers, informing them of the program and what its intended purpose was? I mean, I know you've alluded to, you know, posting on your website or different things like that where the average person isn't going to go looking for it. Did you guys ever consider using a text message to inform everybody that their data was going to be used and could potentially be used by the government to inform policy decisions that would directly impact them?
I'm not sure if we turned our minds to that particular solution. What we did is we took the steps that we thought were appropriate, and you know, we were pretty loud about it with media releases in the context of the pandemic, and we put a lot on our website, as I've indicated earlier. All of our 5 core data commitments, all of which we had taken to the Privacy Commissioner. To ensure that we were properly being transparent about what the program is and giving the right assurances to our customers.
So just kind of a clarifying statement here, I guess, or just maybe a reassuring statement here. On behalf of Canadians, I guess, from the company side, under this program, at what point will the data that the federal government is using, will it be returned to you, or is there an assurance from the government that it will be destroyed and not be held longer than is necessary?
So in terms of, I just want to go back to what it is that the government has. We're talking about heat maps and charts, insights drawn from the data. This is not our customers' identifiable data. So where normally, if we're sharing actual data, there would be that type of requirement to destroy the data. That doesn't necessarily have the same import here, but nevertheless, we do have restrictions on the retention of the data.
Okay, will you guys be destroying the data then that you've collected, or do you guys have a mechanism for your subscribers to reach out to you asking for the deletion or the release of that data that's been collected to the individual directly?
I will allow the witness to give maybe a 1 or 2 word answer if possible, and then we'll go to Mr. Fergus.
The de-identified data on our websites could never be provided back to an individual because it is not identifiable data. We have the identifiable data that we collect originally.
We'll go now to Mr. Fergus for 5 minutes.
Merci beaucoup. J'aimerais remercier
Thank you very much, and thank you to the witness for her presentation. I have several questions to ask her. Like the others, I don't want to be impolite, and because we also have interpretation, there's also a short time lapse before you hear the full question. You said that this data is de-identified. According to the industry and several academics, do you think that your Data for Good program meets the highest possible standard of de-identification of data?
I absolutely think that it meets a very high standard. I don't know if the standard is shifting all the time. There are new technologies that are being developed all the time. So this is something that we are constantly reassessing, whether or not there's more that could be done to further minimize the re-identification risk. That's a process that we're always looking at. What further controls could we layer in? But absolutely, we would not have achieved the Privacy by Design certification if we did not have we're not right up there with the highest standards. We also received the International Award for Privacy Innovation at the end of 2020.
Oui, vous avez mentionné ça.
Yes, you mentioned that. One of the witnesses that appeared before this committee, Dr. Kuvakian, hailed your program, Data for Good. On the other hand, she was very critical in saying that the government should have ensured that the Privacy Commissioner examine the data you provided to the government. Are you aware of standards, of the standards used by the Privacy Commissioner?
I'd just like to clarify the question, the standards used by the Privacy Commissioner to assess de-identification methodologies?
Exactement.
Exactly.
No, I'm not. Those have not been published.
Oh, alors il n'y a aucune indication.
So in the industry, you who are taking care of the data, you're not aware of the standards that were established by the Privacy Commissioner?
It's not that I'm not aware of standards that were established. There haven't been published standards about how to de-identify. So the fact that data must be de-identified to the point where it's not reasonably likely to be identified back to an individual in order to fall outside of the privacy legislation, the commissioner is very clear. But in terms of exactly what his office would be looking for if they were to assess our de-identification methodology, there's nothing published on that.
Bon, avez-vous...
All right. What standard or what format do you use? What metric do you use to assess what you claim that your system is waterproof, that reasonably speaking, you ensure that the data you share is identified?
Thank you for the question. As I mentioned earlier, we worked very closely with the leading de-identification experts, and we have continued our work because we saw this as so important to try to develop standards in this space. We work with the leading de-identification experts on Canon. We co-founded Canon, the Canadian Anonymization Network, to continue to push forward the technology around de-identification and arrive at standards. As you heard from Dr. Khaled El Imam, there are industry standardized techniques. There are certain approaches that the experts will take. And one of the ways that we can test those is to subject the data sets to re-identification attacks and to consider the types of re-identification attacks that could be executed.
Do you do these attacks, these re-identification attacks, very often?
I'm not sure what very often would be, but we definitely have done rigorous re-identification tests and attacks, and we've commissioned them. That's part of our work with experts, was to do that very thing, to make it as bulletproof.
Once a year, for example, or?
Mr. Fergus, and now we'll go to Monsieur Villemur.
Mr. Villemur, now you have 2.5 minutes. Thank you, Chair. Ms. Snively, I understand that consent is not always obtained at the source, and the Privacy Commissioner wasn't very comfortable with this idea. What should be done in the future to improve this situation?
I believe in the context of de-identified information that the focus should be on the actual core privacy protections. So we can look at, and I think Bill C-11 started down this path, that we can do more things with de-identified data, but perhaps the space that it had for codes of practice would be a great place to put some of these standards that we were just talking about. And how can we get comfortable that we're all talking about the same thing around de-identification, raise that standard. But I think the most important thing is, as I said earlier, not to rely on consent, because we're talking about de-identified information, but to rely on absolutely substantial privacy controls that are in place regardless of the choices or selections. We know that choices and selections are challenging, so let's just get it right.
D'accord, merci. Je vais vous interrompre, j'ai seulement 2 minutes.
Thank you. I'll interrupt. I've only got 2.5 minutes. Were you inspired by the GDPR?
I think there are some great aspects to the GDPR, and certainly we see in it they have embraced privacy by design, and that's part of what we believe in as well. We've been embracing the privacy by design concept for a long time at TELUS. I think there are some terrific aspects of the GDPR. I also think there's some terrific aspects to our existing legislation. It's been very principle-based, although old. It has served us quite well because it is principle-based. So it has not been technology-specific and has allowed us to be, nimble and agile in the way we've assessed privacy.
D'accord.
Do I think there can be tweaks? Yes.
Dans l'esprit du commentaire.
Following up on what my colleague said, do you think you could have been more proactive with the text message instead of just saying you have to go and look at the website?
I think before we start looking at something like a text message, I think there are a lot of considerations that would go into that type of thing. What we tell our customers all the time is, please don't respond to a text message from us that you are not expecting, because it could very well be phishing. So there are a lot of different types of considerations that go into texting customers. A lot of customers do not want to be texted. So it's not a simple decision to simply actively reach out to customers. And if we were to do that, I'm not sure how that would play out. So our focus was on protecting privacy.
I'm going to have to stop you. I'm sorry. I did actually allow a fair bit of extra time there in recognition of Monsieur Vermeux's earlier round, but we really must go now to Mr. Green. So go ahead, Mr. Green, for 2.5 minutes.
Thank you. And there's certainly been a lot of discussion about what meaningful consent looks like throughout the course of this study. We've heard today the witness talk about drivers in their current policies as a corporation under current legislation. I want to state that it's my hope that we extend this investigation into what I consider to be the underlying deficits in Canadian privacy, transparency, and accountability laws that have enabled this kind of collection in what I consider to be a surreptitious way. And as has been identified, the capitalization, the commodification of data, big data in particular. So my question through you, Mr. Chair, to the witness is that if this session of government was able to effectively modernize our privacy acts and legislation to bring under the purview of privacy big data, as I believe big data has certainly surpassed, and the technology has surpassed its current use, how would TELUS adapt to include all data in their frameworks of meaningful consent?
That's a challenging question without knowing what the changes would be. But I do want to make one thing clear, and that is that we have gone above and beyond the law. So I think a lot of the things that we have been doing in our strong de-identification methodology are rigorous reviews of the purposes for which this data is used, the transparency on our website, the transparency around specifically data for good. Those are all the types of things that would likely be in the new legislation.
One specific question, and hopefully the member can provide it back in writing. We heard time and time again about de-identified versus personal data. If we were to treat de-identified data as we did personal data, given its source, could the witness provide us in writing how they would go about providing meaningful consent to their clients when they're using data in this way. Thank you.
Sir, as well.
I can take that away.
Okay, all right. If that's sufficient then, and we'll look for a written response to that question, then we'll go now to Mr. Couric for 5 minutes, and we'll finish off with Ms. Sachs.
Thank you very much, Mr. Chair, and again, thank you to the witness for your testimony here today. So I am just wanting to affirm, and I hope that we can get some more information about both the portal and the information that was provided to PHAC. In addition, as I've been considering your testimony, it would be, I think, very helpful and important for Canadians to be able to understand what the query-based system looks like, what types of queries could be asked. So if I could ask that information be provided to this committee so that we can most effectively consider that as we are writing our report.
Absolutely, I can take that back and discuss how to present that to you with my team.
Thank you very much. Now I'd like to transition a little bit, if I could. You referenced a number of times that TELUS had spoken with the Privacy Commissioner, and I'm just wondering if you did receive an opinion from the Privacy Commissioner on the TELUS Data for Good program, or was it just a discussion with? Can you outline exactly what that interaction was?
Yes, thank you for the question. Prior to launching Data for Good, we, as I indicated earlier, we designed our 5 data commitments, our 5 commitments around sharing of data and protecting privacy. We were trying to anticipate what our customers would be most concerned about if they were to hear about this and address those concerns. So it was very much part of our transparency plan was to publish these 5 commitments as well as a description of the program along with FAQs. So we took the description of the program and the 5 commitments, and we sent those to the Privacy Commissioner and asked for feedback on those, which they provided, and we incorporated that feedback.
I find it ironic that it appears that TELUS went through more steps to protect its users' privacy than the Public Health Agency of Canada did. Certainly, in reference to the testimony that we received earlier. So when it comes to what the Public Health Agency of Canada did, were there frameworks or restrictions that would have ensured that this data was siloed or had a certain restricted level of use that either wouldn't have gone beyond PHAC, that queries and information that were sent to PHAC had to be managed carefully? I'm just wondering as to when the data leaves TELUS, what assurances were there that it wouldn't be shared with, for example, other agencies and departments of government?
I think it's very important to reiterate again that this was not actual data sets that were provided to PHAC. We're talking about, again, heat maps, derived data. So
I understand that. So were there assurances, though, that as the Public Health Agency of Canada was using your platform and dashboard and whatnot, were there assurances and requirements that PHAC would be the only agency allowed to use that, or were they given permission to share it more broadly?
They were given permission to use it in accordance with the purposes, and we were aware that they would be sharing it more broadly wherever it could be used to serve that particular purpose which was the containment of COVID-19 and to help fight the pandemic. So that was the social purpose behind the program. If it were consistent with that social purpose, it was permissible. Okay,
so with that in mind, I'm very curious again as we look forward. There has been an RFP that has been put out by the government asking for data related to both the fight against COVID-19, but requesting data for further purposes beyond that. We've heard some testimony about what some of the challenges around that, and this committee actually unanimously had asked for there to be a pause on that until we could have a better understanding as to what that is. So, are you aware of that RFP, and do you have any comments on that?
I've heard about the RFP. I don't have any comments on that.
Okay. Okay. Thank you very much.
We'll, with that, go to Ms. Sachs for the final 5 minutes.
Okay. It's been a long afternoon, but very informative, and I want to thank our witness again for her very detailed explanation of the steps and the processes and the supervision and thought that went into both constructing the TELUS for Good platform and its uses. So TELUS for Good's platform is not only used by PHAC, it's used by university researchers. It's almost like a library in some ways. Would you agree? With a lot of supervision and a lot of guardrails?
With a lot of guardrails and supervision, yes.
Okay,
the idea is to support evidence-based decisions.
Absolutely. And so perhaps I would like to phrase it this way. You were obviously, TELUS for Good from its inception was very deliberate in the approach that you took in designing this platform. And in the end, you've won awards. You've really received accolades from Dr. Anne Kavukian. Could you just talk about the guidelines or metrics that you use and let's say, you know, the commissioner in his testimony talked about frameworks that he had outlined in relation to the COVID Alert app, which were not, I'm actually not quite sure if those are public or not public. Based on your previous comments, I'm not really quite sure they are. You know, what key frameworks, we talked about privacy by design, but were there other frameworks either from the Privacy Commissioner or the Ontario Privacy Commissioner that helped guide and structure the process for design and how you use it now?
In terms of specific frameworks, as I said earlier, we did work with experts from across the country as well as even outside the country to look at what are the best strategies and techniques for strong de-identification. There are a number of different strategies to approach de-identification. We actually kind of employed more than one. Took a bit of a belt and suspenders approach. But is there an actual standard? Follow these 25 steps and you will have de-identified data. That doesn't exist. It is contextual and it's more complex than that. But we have worked with all the leading experts on how to develop frameworks that are as robust as possible.
Thank you. Mr. Chair, I'm going to be sharing my time with my colleague, Ms. Collett, so I will pass it on to her.
Thanks very much. How many minutes do I have, Mr. Chair?
You have about just a little over 2 minutes.
Wonderful. Thank you very much for your testimony and for answering our questions. Much appreciated. Now, I just want to bring it into, again, we've been asking a lot of questions around informed consent of the use of Canadians' data. And perhaps I want to take a kind of a step back and put it into more layman's terms that Canadians can understand. Let's say, for example, somebody signs a petition that is being circulated by an MP that is running for a leader of a party, for example. Now, would they then, that MP, would they need, informed consent to then later use that data for other purposes as opposed to just the reason for this person signing that petition? Is that, and if that data was used for other matters or data mining or what have you, would there be an obligation on that organization to seek that informed consent, do you think?
I think that's a really interesting question. And it's a great question because the analogy might be to say there are 3,000 people signed the petition to support a particular MP, and the MP makes the conclusion that 3,000 people in the country support him or her. That conclusion is the type of insight we're talking about. So when the MP goes and says, I've got 3,000 people supporting me, and that's why, I think I should be able to do this or raise this much money or do these other things because I know I've got 3,000 people supporting me. If that's not what their original intention was when they signed up, they were just giving it for some other reason, then we're in the same boat. But clearly that's not the idea here. We're talking about aggregated concepts of patterns and trends, and nobody would expect that the MP would go back and get consent for everyone for every conversation that he or she has about that 3,000 number.
Thank you so much for that. And do you have any recommendations with respect to strengthening government policy, with respect to how companies, private or public, collect, store, and use data, specifically with respect to informed consent and how the framework is in our government?
We're going to have to wrap it up. You are actually over time now, so maybe a quick comment or response from the witness, and then we're going to have to wrap it up.
We've been actively participating with any consultations that the government's been holding on how best to improve our privacy legislation. So I'll leave it at that.
Okay. All right. Well, thank you very much. That'll conclude panel number 2. I will ask the witness. There were several questions that requested written responses, and I think there was an undertaking from the witness to provide. In some cases, if you're able to do so, please do so as soon as possible. And with that, this meeting is adjourned.